Hello friends, I am Dr. Ranjan Bhattacharyya, consultant psychiatrist. I am working as head of the Department of Psychiatry in the Murshidabad Medical College and Hospital. I am also the assistant secretary of the IMA Bengal State branch. So during this pandemic, we all know that the mental health issues are coming up, and there is upsurgence of the various psychiatric problem across all ages in both sexes. So we thought that it is a high time to form and release a COVID management related guideline during this COVID pandemic. So there are 13 authors who have contributed in this book, and the chapters are written in a meticulous manner, and the lead authors are being 13 in number, assisted by other authors. And this book has been edited by myself, Dr. Ranjan Bhattacharya, and I have been assisted as co-editors by Dr. Anirban Dolui, who is the assistant professor of the Department of Community Medicine, Arjikar Medical College and Hospital. He is also the Assistant Secretary of IMA Bengal, as well as with the help of the Dr. Tamagno Bandyopadhyay, who is the Aramukam Clinical Tutor, and Dr. Aratrika Sen, Senior Resident of the Department of Psychiatry, Murshidabad Medical College and Hospital. I am really privileged and honored that our beloved State Secretary and former National President, as well as the Honorable Member of Parliament, Dr. Shantanu Sen, has given me the permission, and he encouraged me throughout the course of writing this book, and I have been indebted to the various authors who have contributed in this book. You'll be amazed to know that the authors from various premium institutions like All Indian Institute of Medical Sciences, PGI Chandigarh, NIMHANS Bengaluru, all have contributed in this booklet. So I have shown in this screen that the title of this book goes like The Guideline for Managing Mental Health Issue During this COVID-19 Pandemic. And you can see it is released by the IMA Bengal State branch. The editor being myself, and co-editors as mentioned by the Dr. Anirban Dolui, Dr. Tamagno, Dr. Aratrika Sen, and the list of authors ranging from Dr. Kaustav Chakraborty, Dr. Sujit Sharkil, Dr. Rajesh Shinagi, Professor Dr. Shandip Guver from PGI Chandigarh, Dr. Shavita Malhotra, Dr. Anirban Roy, Professor Dr. Malay Ghoshal, Professor Dr. Atul Ambikar from AIMS Delhi, Dr. Sheshadi Chatterjee, Dr. S.S. Datta, Dr. Sharmila Sarkar, Dr. Sudhendu Chakraborty, Professor Dr. Uday Chaudhary, as well as Dr. Shaki Banerjee, Dr. Ishan Chaudhary, and Dr. Arnab Mukherjee. The book begins with the messages from various dignitaries, starting from our National President of Indian Medical Association. He has given this message, Professor Dr. J. Jayalal, followed by the message of the Honorary Secretary General, Dr. Jayesh Lele, then the message of our beloved State Secretary, Dr. Shantanu Sen, Honorable MP of Rajya Sabha and immediate past National President, followed by the President of the IMA Bengal State Branch, Dr. Santosh Kumar Mundol, then our Honorable Director of Medical Education, Professor Dr. Debashish Bhattacharya, our Director of Health Services, Government of West Bengal, and ex-official Secretary, Dr. Ajay Chakraborty sir, then our very own Professor Dr. Jyotirmoy Pal, who is the Professor of Medicine of Arjikar Medical College and Honorary Secretary of the Jima and Dean of Indian College of Physicians, giving us the message. Our very beloved Dada, Dr. Gautam Shah, who is the President of the Indian Psychiatric Society, and Professor Dr. T.S.S. Rao, who is the Honorary General Secretary of the Indian Psychiatric Society, also have sent us welcome messages, and Dr. Nilima Kadambi, who is the chairperson of the IMA National Committee for Emotional Health and Emotional Well-being of the Medical Students and Doctors of India, has sent us these messages. So this book, starting with the first chapter with COVID-19 and psychiatric issues, which tells us about the various neuropsychiatric manifestations of COVID-19, the CNS involvement and PNS involvement, and acute and chronic psychiatric symptoms, and the mode of spread of the CNS by virtue of the transsynaptic spread, as well as the crossing the blood-brain barrier, and various psychological disruptions like changing the lifestyle and socialization, extensive lockdown, unemployment, and descent of economy, which has led to the various psychiatric comorbidities. The mental health consideration that are due with the management of the COVID-19 pandemic has been given in this algorithmic form and pictorial way, and followed by the management of the psychiatric patient developing COVID-19 in a flowchart manner. As you can see in the OPD-based management as well as the indoor-based management have been highlighted, followed by the flowchart of this management. If the patient is mentally ill in the COVID ward, then assessment should be done by the psychiatrist within 24 admission. If it is agitated, If the patient is having remission of symptom and relapse of symptoms, the various treatment options are given. This ends with the first chapter. The second chapter has been written by Dr. Kaustubh Chakraborty, Honorary State Secretary and the Associate Professor and HOD of the Department of Psychiatry, College of Medicine and JNM Hospital. He has written about the depression in COVID-19, how to approach. We know that depression has been found to be on rise during the impact of the pandemic. And in various studies, it has been found that the children and adolescents are suffering from the various problems like irritability, defiant, disobedient behavior, anxious behavior, and crying spell. And he has highlighted the various lifestyle modification in the context of COVID-19 and depression, and the differential diagnosis of the depression of the COVID-19. This was followed by the management of depression in COVID-19 in a algorithmic flowchart form. Mild to moderate symptom treated with SSRI or SNRI plus psychological therapy like cognitive behavioral therapy, interpersonal therapy, and the severe depressive episode treated with preferably with the dual-acting drug like SNRI or mirtazapine or combination of antidepressant and ECT and the repetitive transcranial magnetic stimulation. The third chapter is written by Dr. Shujit Sharkil, the Associate Professor of Psychiatry of Institute of Psychiatry, Kolkata. He has written on the managing of OCD in COVID-19 pandemic. The International College of Obsessive Compulsive Spectrum Disorder and Obsessive Compulsive Identity Disorder Research Network at the European College of Neuropsychopharmacology published a guideline for the treatment of OCD during COVID-19, and he has highlighted these issues. First, the confirming diagnosis of the OCD, then psychoeducation of the COVID-19, followed by the pharmacotherapy as the first-line management of any SSRI. And then, if it is not responding with the initial SSRI, then try another SSRI. If there is still no response, try tricyclic antidepressant, clomipramine, then inadequate response. Review the dosage of the drugs and duration of 12 weeks of trial of each drug is necessary. Then low dose antipsychotic augmentation with aripiprazole, risperidone, quetiapine, olanzapine are being recommended. So this ends this chapter. The next chapter has been written by Dr. Rajesh Yogi, who is Assistant Professor of the Arjical Medical College, Department of Psychiatry. He has written on dealing with anxiety and stress of COVID-19 patients. He initiated with the worried world concept and the management of this. Do not turn them away or dismiss their problem. Provide the correct and authentic clinical information. This information tsunami or infodemic is prevailing allwhere. The recommendation for pharmacotherapy in anxiety and stress have been highlighted, and their salient points have been mentioned by Dr. Niyogi in his chapter. And avoid the antidepressant anti-anxiety combination, the unsafe profiles with the various drug that is used in management of the COVID. This have been highlighted, and the take-home message is that management of anxiety, essentially in the COVID-19, has a direct implication of the course and outcome. Early assessment is needed for the better care. Watch out for the drug interaction potential delirium. Simple reassurance and follow-up for anxiety is most important. Professor Sandeep Grover has written the next chapter on the psychosis and delirium in person with COVID-19 infection with the assessment and management. He has beautifully highlighted in the figure format patients to be assessed initially, and if there is pre-existing psychotic disorder, then has history taken and continuation of the antipsychotics. If the patient is having new onset psychotic disorder, then the assessment followed by if there are the three kinds of management: if the new onset cognitive symptom, new onset psychotic symptom, and the new onset psychosis along with the predominant affective symptom can be managed accordingly. The next chapter has been written by Dr. Anirban Roy and Dr. Shobita Malhotra on the psychosocial intervention for children and adolescents. They have highlighted the children can be affected in various ways, and psychosocial impact of the children of COVID-19 on children have been highlighted. The most important issues have been highlighted, which has been prevailing all over the world, like alleviating anxiety, providing comfort, set direction and goal, and acquiring an understanding. They have highlighted what should parents do and what should parents not do. Children in whom family members are affected and children who are infected themselves and children who lost their near and dear ones can be managed in different ways, and that had been highlighted by Dr. Anirban Roy and Professor Shobita Malhotra. The next chapter is written by Professor Dr. Malay Kumar Ghoshal on geriatric well-being and during COVID-19, the direct effect on COVID on mental health, and those who are already suffering from mental disorder, the direct psychosocial impact of COVID on elderly mental health have been highlighted. Etiology of neuropsychiatric disorder has been held in a box form, like the tissue hypoxia, desaturation, neuroinflammatory cytokines, loneliness, isolation, financial problem, bereavement, stress, so on and so forth. And some common strategies of taking care of the elderly have been highlighted. And finally, in the flow chart, Dr. Professor Ghoshal has highlighted the approach to cognitive impairment of following the COVID. So this ends this chapter, followed by the next chapter written by Professor Dr. Atul Ambekar, who is a professor of National Drug Dependence Treatment Center, Department of Psychiatry, All Institute of Medical Science, on challenges in managing substance use disorder in COVID-19 pandemic. He has highlighted the managing substance disorder during pandemic and clinical and public health aspects. And there are various conditions how to manage, like alcohol withdrawal, alcohol dependence for relapse prevention, as well as the opioid withdrawal, opioid dependence. And finally, the concluding with this remark that the responsibility of all health professionals has considerably increased during COVID-19 pandemic, and substance use disorder are stigmatized and underserved health condition even in best of the times. So utmost care in this issue is required. So this is, the next chapter is about the post-COVID fatigue syndrome and consequences thereof, written by Professor Dr. Uday Chaudhary, Dr. Shaki Banerjee, and Dr. Ishan Chaudhary. And we all know that the post-COVID fatigue syndrome, the myalgia, and the chronic fatigue syndrome are the terms that have been interchangeably used. And they have highlighted about the predictor and risk factor of the long COVID-19, like the older age group, the abnormal lab result, underlying comorbidities, miscellaneous factors, and prolonged ICU stay. Then classification of the long COVID has been given, and depending on the duration of the symptoms and how to approach the COVID-19 symptoms with the acute stage of illness and acute stage of illness with long COVID and short COVID have been beautifully depicted in this tabular form. And in this flowchart of various psychopathological mechanisms of the long COVID have been highlighted. This includes the infection, inflammation, comorbidity, and psychosocial issues. And finally, the post-COVID syndrome categories in the form of post-COVID fatigue syndrome, post-COVID cardiorespiratory syndrome, post-COVID neuropsychiatric syndrome, post-COVID GI syndrome, and post-COVID hepatobiliary syndrome with their manifestations, and the post-COVID musculoskeletal syndrome have been very well highlighted. So this ends with this chapter, and the next chapter has been written by Dr. Sheshadri Shekhar Chatterjee, who is the uh, assistant professor of the Diamond Harbour Medical College, and he has written that judicious use of the psychotropic drugs in the COVID patient. He has mentioned about the drug-drug interaction, the respiratory risk, as we all know that there is a risk of the respiratory depression and the happy hypoxia issues. He has highlighted the NICE guideline recommendation, the cardiovascular recommendation risk factors have been well highlighted, and especially the common psychiatric medicine and the QTC prolongation in terms of use of antidepressant, antipsychotic, and mood stabilizer. These all issues have been highlighted in the tabular form, and he also have mentioned about the major practical summary, like the use of the steroid, ongoing lithium use should be monitored, valproate does need to be reduced if the LFT is deranged, there's risk of hyponatremia and antidepressant use. This summarizes the topic of Dr. Sheshadri Shekhar Chatterjee. The next topic has been written by Dr. Arnav Mukherjee and Dr. Soumitra Shankar Dutt. Is a very important issue about the impact on psychological health of relatives of patients who succumb to the COVID-19, and they have highlighted the various issues of especially the significantly affected family members living through the multiple losses beyond the death, including that of the companionship, intimacy, and finances, the preparation, the use of technology, cultural issues, expression of emotion, dealing with the nature of death, and taking care of oneself and surviving members. They all have been highlighted. The final concluding remarks by them are like this: that do not skip the meals even when not feeling appetite. To take the regular medication to sleep adequately. Distraction may help during this initial period. To remain in contact with near ones, to gradually re-engage in usual activity. So these ends with their presentation, and the next chapter is written by Dr. Sharmila Sarkar and Dr. Sudhindra Chakraborty about the guidelines how to break the bad news. Setting up the suitable recommendations are extremely important, followed by the ABCDE, that is the advanced preparation, build a therapeutic relationship, communicate well, deal with patient and family members, and encourage and validate emotion. Breaks and the spikes model have also been discussed. And finally, we have appended the guideline of communicating breaking bad news to death over telephone for the hospitalized COVID-19 patient, which has been published by the Indian Psychiatric Society West Bengal State Branch and drafted by Dr. Soumitra Shankar Dutt. The final chapter has been written by our very beloved brother, Dr. Anirban Dolu, who is the Assistant Secretary of IMA Bengal, about the medical teaching and COVID-19 pandemic. He highlighted the various online education and medical teaching, challenges of online mode of education, and also given the various burning issues, the lack of skill, time management, lack of infrastructure, poor communication at various levels, the negative attitude, and the student engagement issues. So mental health issues of the medical students have already also been highlighted in his write-up. The way out and the recommendation he has given in a very simplified manner. So this ends the presentation in this booklet, and I think that this will be helpful to all of you. Please go through the booklet, and this if it is found useful, then please recommend this and do watch the Jima Tube. These all are available in the Jima Tube on a regular basis. I again thank all the office bearers of the IMA Bengal State Branch for giving me this opportunity to write up this guideline. Thank you so much, and thanks for watching.